Women with PCOS have higher level of androgens, including testosterone, proandrogen, androstenedione, DHEAs, and that make women with PCOS to have hirsutism, acne, and alopecia. In last video, we discussed how androgens influence hirsutism and how to remove existing terminal hair. Today, we are gonna discuss the second part of the treatments, how to lower androgen levels. Welcome to Holistic Ovaries. I am Agnese, and if you want to learn how to manage polycystic ovary syndrome, please subscribe to this channel. There are few ways to lower androgen excess: medical treatment, oral contraceptives, alternative treatments, and lifestyle modifications. We will not discuss medical treatment and oral contraceptives because I am not endocrinologist and I am not gynecologist, and foremost because I do not know your personal story with PCOS. I also believe that first-line treatment should be behavioral changes, stress management, learning about nutrition, physical activity, more natural treatments, supplements, herbs, and only then, when nothing worked for you and you are emotionally and mentally drained, to reach out for more traditional medicine. Today we will discuss alternative treatments like supplements and herbs. Please always discuss with your doctor before you start on supplementing, especially if you are pregnant or breastfeeding, and always check for any side effects. So let's start with myo-inositol. Myo-inositol acts as insulin sanitizer. That's why it's recommended for women with PCOS with insulin resistance. But insulin resistance is very closely connected to hyperandrogenism. Several studies have demonstrated that myo-inositol lower testosterone levels and lower androgen index. In one study, the lipid patterns and insulin sensitivity was tested on women with PCOS with hirsutism. The results show significant reduction in hirsutism. Myo-inositol reduced total androgens in the LH to FSH concentration and increased estradiol. Recommended dose of myo-inositol is 4 grams a day for at least 6 months. I myself take 2000 milligrams 2 times a day, 1 time in the morning, 1 time in the evening. I will make separate video about myo-inositol because there are many different types and we need to know which one is the best for us women with PCOS. Spermine. Clinical studies has demonstrated that spermine can be very helpful for women with mild hirsutism. It was confirmed and demonstrated that spermine has androgenic properties. The direct effect was the significant reduction of free testosterone. Peppermint. Peppermint has been shown as an alternative treatment for women with PCOS. It also has anti-androgenic properties and also lower free testosterone. In women with PCOS, peppermint has significant reduction in serum testosterone, changes in LH and FSH, and estrogen just after 3 weeks of administration. The spermine and peppermint can be taken in form of infusion 2 times a day. It can also be found in form of capsule or extract. I drink it very often, almost every day, and I really pay attention to the source. The more organic, the better. Flax seeds. Flax seeds are full of omega-3 fatty acids and are one of the best sources of dietary fiber. Flaxseed or isolated lignan has been shown in studies to lower androgen levels and normalize lipid levels. Lignan minimizes excess testosterone in women with PCOS, and flaxseed reduce androgen levels in women with PCOS. I add flax seeds to oatmeal and my salads every single time. I crush them and blend them before, otherwise they are not going to be digested. A bonus here, combination of spearmint and flaxseed extract shown significant improvement in endocrine profile in women with PCOS. Sao palmetto. Sao palmetto may be very helpful to treat hirsutism in women with PCOS as it blocked receptors that convert testosterone into DHT. The scientific data has not been shown, but many PCOS patients claim the positive results of using Sao palmetto for the decrease of terminal hair and general satisfaction. Recommended dose of Sao palmetto is 160 to 320 milligrams a day. I myself was taking Sao palmetto. I don't do anymore because my androgen levels are at normal levels. Chase 3. You might know it as Vitex. Vitex has also anti-androgenic properties, but it also has estrogenic properties. And here we need to be very careful because Vitex increase progesterone levels by increasing LH. And women with PCOS already have high LH levels. But if your LH levels are normal and your prolactin levels are high, Vitex could be very helpful. Neem. Neem is used in Ayurvedic medicine, and several in vivo studies demonstrated the anti-androgenic properties of neem oil, leaves, and bark. Neem reduces hirsutism and free testosterone by inducing menstruation in PCOS patients and has been shown as an alternative to traditional medicine. Licorice. Licorice can be considered as an addition for therapy of hirsutism in women with polycystic ovary syndrome. The effect of licorice was studied on androgen metabolism, and the total testosterone was reduced within 2 months of administration 3.5 grams of commercial preparation licorice. Once the licorice was stopped, the testosterone levels come back to the levels before the treatment. Green tea. There is some evidence that green tea extract can be helpful in hair disorders, and it shows some promising results to reduce hirsutism. So here we have the supplements and herbs that can reduce androgen levels. Remember though that simply taking a supplement will not make your PCOS symptoms disappear. It is just the addition to other treatments of PCOS, which the biggest one is lifestyle modification. I think the most difficult one in PCOS management. And in next video, we are going to discuss the biggest topic in PCOS community, the diet and weight management. Remember also that high androgens can happen because of so many factors. Insulin resistance, lack of sleep, stress, nutrition full of processed food and sugars. And that all can influence your hormonal imbalances. If you have any questions, please leave me a comment. Remember to subscribe to the channel for more information about PCOS treatment and management. And I will see you in next video. Bye bye.